Well, welcome to Durrie Vision's LASIK 101 webinar, everything you ever wanted to know about LASIK. Before we get started, make sure you have your sound on. Hello, I'm Dr. Jason Stahl. I'm a board-certified ophthalmologist at Durrie Vision, and I specialize in vision correction surgery. So I am what they call a refractive surgeon. What we'll discuss today are the benefits of LASIK, what to look for in a LASIK surgeon, common refractive errors corrected by LASIK, what to expect at a LASIK consultation, the LASIK process, alternative procedures, affordability and financing, and then next steps. Well, what are the benefits of LASIK? Well, certainly you'll save some time if you're able to wake up in the morning and see clearly without glasses and contact lenses. But the biggest benefit that I hear from patients and from my experience as a refractive surgeon is the convenience, and maybe a better word is freedom, waking up and being able to see clearly. There's also safety benefits. I'm not sure that contact lens wearers understand that every day that they place a contact lens on their cornea, there is a risk of infection, corneal scarring, and loss of vision. And lastly, it's a money saver. If you're able to see clearly, and there's no need to be seen yearly by the eye doctor for new prescriptions and purchasing new glasses and contact lenses, the procedure pays for itself after a few years. Well, what do you look for in a LASIK surgeon? Well, experience, I would say, is number one. And I think what's most important is that you actually see a refractive surgeon. LASIK is one of 7 procedures that we do at Durrie Vision. And not everyone's going to be a candidate for LASIK. You want to understand if you are a candidate for LASIK, great. But if you're not, will you be told that you're a candidate for some other procedure? So experience is number one. Number two is technology. We have multiple lasers and implant technology that are utilized within those 7 different procedures that we perform to really customize the procedure for the patient. And technology continues to advance. Just look at our phones today compared to even 5 years ago. And so we've always been on the cutting edge of technology, and that's why we have so many different lasers and technology to provide our patients. As mentioned earlier, there are several options beyond LASIK, and you want to make sure that you're seen by someone who's familiar and has experience with these in order to guide you towards the best procedure for your eyes. And lastly, patient reviews. We welcome you to look at our online reviews prior to coming to visit us. Very important. To us, patient experience is paramount, and this is reflected in surveys that we provide our patients and the feedback that they give us. And 99% of our patients are either likely or very likely to recommend Durrie Vision to a friend or family member. And this is our greatest source of referrals. Well, what does LASIK treat? Well, the most common reason for glasses or contact lenses is nearsightedness or myopia. And this basically means that you can see things clearly up close, but the distance is blurred. Farsightedness or hyperopia is the opposite. This is where you can see clearly in the distance, but things up close are not clear. And astigmatism can be combined with either nearsightedness or farsightedness. Astigmatism means that the curvature on the cornea, the very front of the eye, the big window, is not round, is not spherical. And so when the light enters, it splits the light into 2 different focal lines, and this causes blurred or distorted vision. Well, let's talk about the LASIK consultation here at Durrie Vision. We call it an advanced ocular analysis. This will be the most advanced and extensive eye exam you've ever had. We use advanced diagnostic testing to evaluate the very front of your optics, the tear film on your cornea, all the way through to the back of your eye where your retina and blood supply are. Once this testing has been completed, you'll actually sit down and meet with a surgeon, which is really unusual. Most places you don't actually get to meet with the surgeon. And we will examine your eyes, review all the testing, educate you on how the eyes work, what your focusing issues are, and then determine whether you're a candidate for one of our 7 procedures. If you are, we will walk through a personalized treatment plan for you with a specific procedure, but also technology that we'll utilize. And lastly, you'll have time to sit down with one of our patient coordinators to review all the preoperative and postoperative details prior to scheduling your procedure. Well, let's talk about the LASIK day do's and don'ts. We do want you to have a driver the day of surgery, and you should expect to be with us for about 90 minutes. We'd ask you not to wear makeup or perfume the day of surgery. And it's nice to have your medicated eye drops and artificial tears purchased and with you prior to the procedure so that you can go directly home instead of to the pharmacy once you leave. Let's talk about the day of surgery. Once you've been checked in, we'll do some more preoperative testing and start both numbing drops and antibiotic eye drops. Then your surgeon, either myself or Dr. Lindquist, will come in and walk you through the different steps of the procedure. Next, we'll take you to the laser suite, and you'll lay on a laser bed, and we'll start the process. And there's basically 2 steps. The first step is using a femtosecond laser, and we have 3 of these to choose from, so we can really customize it for the patient. And basically with this laser, in about 10 seconds, we're going to create a thin protective flap in the cornea, which we then reflect back and do the second part of the procedure using an excimer laser. And we have 2 of these, but 4 different software options for what we call the laser ablation profile, which is the treatment, which is essentially where we're reshaping the cornea to correct your glasses prescription. That can take anywhere from 4 to 12 seconds, depending on how much we're correcting. At the completion of this, we gently reposition the flap, and that's the procedure. It takes us about 8 minutes to do this. Most of that time is really positioning you under the laser and getting ready to do the 2 short laser steps. There is Valium that's available if you want to take that to basically take the edge off a bit. And what's so exciting is once we finish and you sit up, you're going to notice that your vision's better. We'll take you back to the post-operative room where we'll review how to use the drops, how to protect the eyes. And you'll notice over the next 2 to 3 hours, the vision is improved. It'll be a little bit foggy. You'll notice that the eyes are a little gritty and scratchy, and I want to encourage you to use lots and lots of artificial tears. Well, post-operatively, we're going to remind you to be careful around the eyes. We don't want any bumping or rubbing during the first month of healing. But really, after that first day post-operative check, you're going to be back doing all your normal activities. Running, working out, working on the computer, flying in an airplane. There's really no restrictions other than we prefer you not wear any eye makeup prior to that 1-day exam, so we can review with you how to be a little bit more deliberate and gentle when you're putting it on and taking it off. And the only other real restriction is we don't want you swimming in a pool for the first week and in a body of water for the first month, just to decrease any risk of infection. Well, what if you're not a candidate for LASIK? Because not everyone will be. And that's why it's important to be seen in a practice that does all 7 refractive procedures. Well, what are the alternative procedures? Well, a very common laser vision correction procedure is advanced surface ablation, or PRK. This is similar to LASIK, only we do not perform the flap part of the procedure. This is usually performed in someone who has corneas that are a little too thin to perform LASIK, or they may have corneal scarring or an irregularity that we want to treat with the laser. For individuals that are very nearsighted, who are not a candidate for any laser surgery on the cornea, we perform phakic intraocular lenses. And basically this is an implantable contact lens that's placed in the front of the eye that permanently corrects very large amounts of nearsightedness, which is very exciting for these individuals. And lastly, for those of us 50 and older, well, we have other concerns, namely being able to see clearly at near for reading. When we're young, the internal lens of the eye is clear and dynamic, and it zooms, and it's great. But as we age, it thickens and stiffens and loses zoom. And somewhere in our mid to late 40s, individuals start to pick up reading glasses or use bifocals to see up close. This dysfunctional lens syndrome continues into our 50s and 60s, where the lens gets a little yellow and scatters light and affects the quality of our vision. And then beyond that, it can become clouded, which is a cataract. So if we see these lens changes, we start to discuss either a refractive lens exchange or refractive cataract surgery, where we replace the natural lens with an artificial clear lens that doesn't age. And the wonderful thing about this technology is it corrects nearsightedness, farsightedness, and astigmatism, but it also can provide distance to near vision, so that patients will not require reading glasses or bifocals. Well, let's talk about LASIK affordability. We really think that this is an exceptional value for the individual. How do you put a price on waking up every day to have clear vision without the need of glasses and contact lenses? We'll review our pricing, and it doesn't vary depending on how much glasses prescription you have. We'll also talk about some nice financing options, and we'll also discuss how you could use your FSA or HSA account to help pay for the procedure. Patients come to Durrie Vision because we have the most experienced surgeons, the most advanced technology, and because of a phenomenal patient experience. To us, everything matters. And so we really would encourage you to look at our online reviews to see what our patients are saying about us. So I hope this webinar has been educational. I hope you're excited about LASIK, because we are. This is our passion. And we'd love to see you at Durrie Vision to evaluate if the eyes are healthy and if you're a candidate for vision correction surgery. So the next step would be to visit our website, durrievision.com, and schedule a free consultation. We hope to see you soon. Thank you. Have a great day.